Healthcare in the United States is expensive. Paying for it can get complicated. If you have insurance coverage, a lot of routine medical care is directly covered by that insurance, meaning all the payments take place between the provider and the insurance company. But sometimes patients have to pay out of pocket and get reimbursed by their insurance later. Maybe this has happened to you. Happens to me all the time. If it has, you know it can be painful. Patient administrative burden is the topic of this week's Healthcare Triage. We've talked a lot about administrative burden in this series, specifically how there's a lot of it in the healthcare system and how much money it eats up. What we haven't touched on is the administrative burden of patients. This is essentially all the non-medical work patients have to do to access care and get their money back once they've received and paid for care, and it can be a lot. Forms, documentation, phone calls, waiting. The list goes on, and we can break it down into three main categories: learning costs, compliance costs, and psychological costs. Let's start with learning costs. This is everything you have to figure out as a patient. What's covered? What's not? Do you need pre-authorization? What form do you use? Why are there 3 forms that all appear identical but are somehow not the same? All of this could fill up a semester-long college course. Once you've done all this self-directed learning, you get to the compliance costs, which is the actual doing of the task you just learned about. Filling out all those forms you track down, getting itemized bills and receipts, uploading documents to a portal you can't remember the login info for, calling customer service again and explaining your situation again. Do you, like me, feel frustrated and panicked and pissed off just hearing about all of this? Excellent. Then this is a good time to discuss the psychological costs. This category encompasses the stress, the frustration, and all the uncertainty baked into these processes. All those brick walls come with a lot of big feelings, usually right when you're already dealing with illness, so that's cool. You already have appointments, medications, and probably some pain or fatigue to worry about. And then, new achievement, you get to become a part-time administrative specialist. Essentially, there's an enormous mismatch between what the system expects and what patients can realistically do. Tasks like getting reimbursed for healthcare expenses often assume a level of organization, time, and persistence that not everyone has. Even small administrative hurdles can lead to people delaying care, skipping claims, or just giving up entirely. Not because they don't need the money, but because the process of getting it is just too much. There's a lot of sludge in the process, which is a non-technical term for all the little frictions in a system that makes things harder than they need to be. Extra steps that seem minor on their own, but that altogether create a system that feels like trying to escape a maze that keeps rearranging itself. And it goes beyond patient inconvenience. It shapes health outcomes. When processes like reimbursements are overly complicated or unclear, people with less time, flexibility, and familiarity with bureaucratic systems are much less successful at navigating things. That means they're less likely to receive reimbursements even when they're fully eligible. That puts us in a situation where the people who most need financial relief from healthcare costs are the least likely to get it. Administrative burden is often shifted onto individuals rather than absorbed by the system. Instead of designing processes that are easy to navigate, we expect patients to persist and to adapt to the complexity. And all of that is even further complicated by fragmentation in our healthcare system. You might have one entity providing care, another billing for it, and a third processing reimbursement. Each one has its own rules, systems, and requirements. So when something goes wrong, and doesn't something always go wrong, you're stuck in a web of phone calls, getting bounced from one place to another, and after a few weeks you've learned nothing except that hold music can, in fact, cause emotional damage. And there are big costs to all of these costs. Repeated administrative obstacles erode trust in the healthcare system, not because people think doctors are bad or care is ineffective, but because the surrounding processes feel so inaccessible and frustrating that it undermines the whole experience. Obviously, some level of administration is unavoidable. No one is arguing that we should just vibe our way through things like healthcare reimbursement. We still need documentation, systems to process stuff, and more. But certainly we can design a system that allows for the essential burdens while providing a better plan for the rest of it, right? Is it so unreasonable to shoot for clear communication, non-redundant paperwork, standardization, coordination? The lack of all of these things is not inherent to healthcare. It is there by design. So we should be able to design our way out of it. Even small improvements like simplifying forms and clarifying instructions significantly reduces patient burden, which increases the likelihood that people will engage with the process. And that's important. For many patients, it's the difference between manageable healthcare costs and real financial strain. When we talk about healthcare systems, we focus a lot on the big visible pieces like coverage and cost, but the invisible parts matter too. All that behind the scenes labor expected of a patient is a real pain point in the system and plays a major role in whether or not that system is working for people. Academy Health is all about making research matter, turning evidence into real world impact on health and healthcare. And that's exactly what Healthcare Triage is about too, breaking down the complex, sometimes messy health policy and research stories that affect all of us. Basically, we're tired of the nonsense. And that's why we've teamed up to bring you this important series. Let's fight the nonsense together. Check out some of the other video series we've made with Academy Health, including this one on getting the right care. We'd appreciate it if you'd like the video, subscribe to the channel down below, maybe go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Liljeholm and Christopher Larn, and of course, our Surgeon Admiral, Sam